Perhaps you've considered joining this cash-based medical care movement in the US and you're wondering, what does it really cost? So, in this video today, I'm going to break down the prices for about 3 different patient categories, let's say. It's going to be a 30-year-old, pretty healthy person who just needs some routine visits. I'm going to do an infant, like maybe a newborn who's going to need vaccines, developmental milestones, blood tests, whatever. And then we're going to do a 50-year-old who might have like hypertension or diabetes or some other chronic disease, who also might need vaccines, but is also going to need a surgery. So here we go. My name is Dr. Ashori. I'm a board-certified family medicine physician turned health coach. And on this channel, we talk about everything related to healthy aging. And you can find out more in the show description. So let's start with the 30-year-old. This is a person who probably has taken good care of themselves or genetically has been lucky and they don't have any medical conditions. They're fit, they exercise, they eat pretty well. But they know that in their 30s, maybe their parents also started developing some conditions. So they also want to be fairly proactive. And they know that a cash-based doctor, like a direct primary care doctor, is going to offer them those options. They're going to help them be proactive, do some screening tests, maybe do advanced screening tests, and help them make all the right choices. Is their weight at goal? Are they active? Are they exercising enough? Are they doing the right things, eating the right things? What about their blood tests? What about colon cancer screening? What about mammography, pap smears? All of these things, that's important to them because they don't want to deal with any of those conditions in the future. A direct primary care doctor can either be in person or virtual. Now, a lot of times virtual is nice because you don't have to deal with waiting forever in traffic to get there. But some things that you can't do in person might be a procedure or like a minor surgery or something, or even a vaccination. But a lot of times virtual direct primary care doctors, like my practice also does virtual primary care, I can offer that to patients. I can send them to local places for vaccines. So a 30-year-old may want to get certain vaccines, and I can send them to Rite Aid, CVS, whatever is still in business, and they can get their vaccines over there somewhere around $30 up to $300 for vaccines like shingles or HPV. But for the most part, it's quite affordable. And this person would pay a direct primary care doctor maybe around $100 a month, and they would get 60-minute appointments, 30-minute appointments, and long discussions. Blood tests for this person, let's say they're going to do some screening blood tests, would probably run somewhere around $60 from companies like LabCorp, Rupa Health, Quest Diagnostics, and maybe $60 to $100 every few years. They could do all of their routine testing done, no problems. And of course, they would then meet with the doctor virtually and discuss all the lab results. Other than that, they might get sick here and there. They might have a little laceration or skin issue. And in a virtual setting, I would usually take a look at the laceration. Is it that big? Well, if it's not, they can probably manage it at home. Maybe they need a tetanus vaccine updated. But other than that, we try to manage it. And if not, I can triage them. Like, hey, this actually could be a bigger complication. You should go to the ER or you should go to the urgent care. I'll find them the right urgent care. I'll help them negotiate cash prices so everything is affordable. All right, so we got the 30-year-old out of the way. I hope that was kind of a good primer for the next one, which is going to be pediatric infant. So we got, 2-week-old. And, well, they're going to need several things. They're going to have some routine blood tests that they're going to do. They're going to have their developmental milestones that the pediatrician is going to want to assess. Now, it could either be a pediatrician or a family medicine doctor. In my practice, I don't do peds. Pretty much 13 years and above is what I manage virtually. I think younger than that, it's always nice to have somebody that can see you in person, but that is also up for debate. And they're going to need their vaccines. So we got lots of vaccines coming up in those little kiddos. And again, pretty affordable, somewhere in the $30 to $100 range for most vaccines. And same with the blood tests, pretty cheap, pretty affordable, and they can go to the same labs to get those done. The developmental milestones is something that we usually assess over video in a virtual setting or in person. And of course, there would be a lot of parental education on breastfeeding if they choose to do so. and kind of helping the kid interact socially and all of the infectious things that come up. Lacerations, trauma, and those kind of things. Usually the pediatrician would be pretty good, especially if it's in person. You drive over there, they can assess most things. But even in my own practice, if I have somebody who's 13 and it's some sort of trauma, and I'm like, I'm more comfortable having you get seen, no problem. I can find the right urgent care again or emergency room. But same thing, the cost can be somewhere around $75 to $110 for direct primary care for a pediatric patient. And sometimes if all the vaccines are included, they might charge a little bit extra, like $175 a month for those first few years, but pretty affordable. Next one we got is the 50-year-old. So this is somebody who's got chronic diseases. They're going to need blood tests every probably 3 months. So factor $100 for all the blood tests. They're going to need medications. Cash-based medications are quite cheap. They're actually cheaper than insurance-based medications. So I can send my patient to Cost Plus Pharmacy, to GoodRx, to Canada Online Pharmacy, I think it's called, and a few other places, by the way, that I use, and they can get their medications for next to nothing. They can get their blood pressure medicine. One of my patients is getting their lisinopril for 90 days for, I think, $12. They're getting a cholesterol medicine for $15 for 90-day supply, so really, really affordable. Same with antibiotics, same with other chronic diseases. So this person takes their blood pressure medicine regularly. They just started on cholesterol medicine, and they're meeting regularly with their doctor to try to improve their lifestyle. So they have a direct primary care doctor, again, $100 to $150 a month. They're meeting with them regularly, once a month, even just to make sure that they're on track. And all of a sudden, they start developing this kind of right upper quadrant pain, some nausea, they had recent weight loss, and their primary care doctor, me, says, go to the urgent care, let's get you checked out. They go to the urgent care, they're like, yeah, this could be gallstones. They get sent for a same-day ultrasound. The ultrasound end up costing them $150 cash. And that report comes both to me and the urgent care doctor. We both find out at the same time. I call the patient. I'm like, it's gallstones. And actually, the urgent care doctor said, you need to immediately go to the emergency room to get that gallbladder taken out, cholecystectomy, as it's called. And we had a much deeper discussion, and actually most gallbladders don't need to be removed, even if you have gallstones. Now, if they acted up, we need to figure out a way to prevent them from acting up in the future. In this case, the patient actually wanted to get the gallbladder taken out, so we shopped around for some cash-based surgery centers like Oklahoma Surgery Center, the Texas Surgery Center, and then there's a couple other ones. And this patient actually wanted to go either Thailand or Mexico for many reasons. He's had family over there and he's traveled a bunch in those places. And so I called around and, emailed around and found a couple of great surgeons, great locations, and he ended up having his surgery pretty much while on vacation, which was great for him. If he had the surgery in the US, he probably would have paid somewhere between $3,000 to $8,000, depending on where he would have wanted to go and whether he would have had any complications that would have required him to be admitted, which is rare. If he had done it at the hospital, it would have been closer to $8,000. If he did it in an outpatient surgery center, it would have been closer to $3,000. He ended up getting the surgery overseas for a little less than $2,000. Now, we found prices all over the place, but this was a very reputable place, and $2,000 was a great deal. He ended up staying one night at the hospital because he said it was like a luxury place. So he's like, yeah, I'll pay the extra money. I don't know how much he paid extra. I think it was $700 extra just to stay that night in the hospital. So that's him. And that's the kiddo. And that's the 30-year-old. That's what it really costs to get medical care cash-based in the US. What I'm not including, what we're not talking about, is major trauma, advanced cancer, or autoimmune medications, and many of the newer medications, which are incredibly expensive. If you had to take those for rheumatologic conditions, for major endocrine problems, if you had to get bypass surgery, if you had to get major spine surgery, or if you had to be admitted to the ICU, if you have to have major aesthetic surgery, plastic surgery after a major burn, those are very different. They're so unique. There's no way I can cover those in this video, but I hope that I helped you cover probably about 96% of the US population who would need care in the cash-based world. If you want to find out more, go to drashori.com, where I do health coaching and direct primary care for patients in California. Otherwise, leave a comment below. Do you have a DPC? Do you have your own cash-based doctor, concierge, cash-based, or do you just prefer the insurance-based system? Take care.